I came back to UCSD in 2020 to become part of a team that is committed to creating a culture and environment where we all can thrive, where we celebrate that which makes us unique, a place where we don't have to lean in, but where we can stand tall and be authentic to our true selves. I came back to UCSD to become part of a team that doesn't just talk about the need to change, but talks about how we can change and what we need to do to not just become more inclusive, but to address the obstacles and mistreatment of the underrepresented.
Hi, my name is Jacob Bailey. I'm a third-year pulmonary critical care fellow, and this is why health equity is important to me. I grew up in a predominantly Latino community. My mother is Mexican American, my father is Caucasian. And so the disparities that I see in our society are a big reason why I went into medicine in the first place. My scholarly activities tend to revolve around who, how, and what we teach in medical education, with the intent that it will help us better improve the healthcare workforce as well as healthcare delivery.
As a member of our Equity, Diversity, and Inclusion Committee, I care about engaging individuals and community members who are underrepresented in biomedical research. We recognize some of those most greatly impacted in our hospitals and clinics are among the least studied in terms of clinical and genomic research. I founded and co-direct the center that aims to maximize interdisciplinary research to improve the quality of life in people previously understudied in pulmonary, critical care, and sleep medicine through local, cross-border, and international efforts. Our focus on EDI within the division helps integrate these varied perspectives and fosters growth for new biomedical discoveries relevant not just to some, but all members of our community.
I believe that equity, diversity, and inclusivity are highly important in our field of pulmonary critical care and in our division in particular, because every voice is important. And by listening to more perspectives and different points of view, we will have more novelty of thinking and we will excel more in both the area of medical innovation and research innovation. In addition, I have multiple family members and friends who are gay, non-binary, transgender, Black, Hispanic, and I believe all people deserve the best opportunities for training and for healthcare.
I believe in the need to address equity, diversity, and inclusivity in our division because it leads to us doing better. With diversity of thought, of experience, of background, we'll be better equipped to accomplish the missions of our university and our health system. We'll take better care of patients. We'll do better research with more meaningful outcomes, research that doesn't ignore the impact of pulmonary disease, sleep disorders, and critical illness on traditionally underserved populations. And we'll teach our fellows, our residents, our nurses, our med students how to engage with their community so that we can make sure that we learn to incorporate an understanding of how a patient's background informs their experience with the medical field and their approach to illness.
So I grew up mostly outside of the US, and I do most of my research outside of the US, usually in very low resource settings. And I think the thing that strikes me most is that over and over again, I see that it's impossible to predict where the next best idea will come from. It's also impossible to predict who will drive that idea through to the next innovation in medical therapy, the next innovation in diagnostic instrumentation. And it's with that in mind that I think about diversity and inclusion, not as a policy to be followed, but rather as an opportunity to ensure we're recruiting the very best with the widest possible diversity of thought, the widest possible diversity of creativity, the widest possible diversity of opinion.
So I remember when my older daughter was about 4 years old, she came home one day and said, "Daddy, I can't do this because I'm not a boy." And I remember kind of bursting into tears, and I told her, you can do whatever the bleep you want. I don't usually curse at my kids, but I made an exception that day because I obviously didn't believe that. And that was, ever since then, and even before then, I've always been focused on putting women in leadership positions and really having them show their strength. Under the leadership of Rebecca Sell and Angela Meyer, we actually published a paper on cardiac resuscitation and showed that females leading codes, cardiac arrest, actually have better outcomes than otherwise. Whether that's true or not, I don't know, but certainly a lot of testosterone is not usually the solution during a cardiac arrest. And so that is pretty clear. On the international side, I've always been interested in global education. So through the American Thoracic Society, we developed a program called Global Scholars, trying to educate people around the world and develop the next generation of leaders from developing countries. And so for me, the equity and inclusion has always been kind of a no-brainer. It's the right thing to do, obviously. But my focus has not been on sort of trivial things about what we call this or that or whatever, but really trying to empower the next generation of leaders so that people with diverse backgrounds are in leadership positions and young people have role models that can really take things to the next level. And that's what I've always done in terms of my career.
I am interested in equity, diversity, and inclusivity because I feel that they are crucial components of a strong healthcare system. This has been particularly evident during the COVID-19 pandemic, which demonstrated unequivocally the importance and urgency to address healthcare disparities and inequities, many of which underlie the healthcare outcomes that we have seen, sometimes on a daily basis. We must work to incorporate lessons learned to achieve a more just and equitable healthcare system. In my own work in the affiliate hospital network of UCSD, I oversee critical care programs that serve communities along the US-Mexico border. These folks come from a diversity and richness of cultural, social, economic, and other backgrounds and contexts. And not only is it personally fulfilling for me to work with these communities directly, but it also allows me the opportunity to deepen my own understanding of their challenges and work with them side by side as a fellow community member, because I'm working in the community that I live as well. Trying to bring some of these experiences into our own approaches as part of the UCSD training program is a core value of the division. And I take a special pride in working alongside my colleagues towards this mutual goal. We all are working to celebrate our individual differences and diversity of experience and background, and we hope that these can be the foundation towards building a better practice medicine delivery mechanism, as well as achieving the healthcare outcomes that can be shared between all of us.